The last thing Yogi Bhajan said to me when I saw him in his physical form last, which was about the year 2000, he made it clear to me that I would know that it took 25,000 years to develop Kundalini Yoga. All right? And at different times, I'll explain that a little bit more. But he also said that Lord Krishna was a master of Kundalini Yoga and a teacher, of course, of it as well. And he taught it. But Lord Krishna also was a master in a Mahan Tantric. He taught white Tantric yoga. So all of this stuff goes back into civilizations we don't even have in record here anymore, you know, at least in the Western record. So stuff after it was discovered then got copied, so to speak, in the ether, you know, in the etheric realm, in the Akashic records. And there was always one master, one Raj Yogi, that was the guardian of all of it. And from at this point, you know, it's Guru Ram Das who is in charge of that huge ancient technology of the mind. So it's not like it was just the last 25,000 years. It could have gone back 800,000 years, but it took 25,000 years total to develop what he started teaching. And he taught about 5,000 different meditation techniques. And I wouldn't be surprised if there's still more in the ethers that hasn't been taught. So let me just give you a very short background on me. I'm now 73 years of age. I was born in West Hollywood, which is a small section of Los Angeles, California. And I've lived in Southern California almost all of my life. When I was age 26, I had the opportunity to take a class on Kundalini Yoga. That was back in 1974, the summer of 74. So I've now been doing Kundalini Yoga for 47 years. I was not looking for a spiritual teacher. I was not looking for a religion. I had long hair, but I certainly wasn't wearing a turban at that point. But then when I was in teacher's training for Kundalini Yoga, and it's something I wanted to do as soon as I started to learn the benefits. And I learned a lot of the benefits in the very first class. It was sort of mind-blowing, to say the least. And I got into a very blissful state. And I quit using anything else for that purpose, if you gather what I'm saying to you. So it has many, many purposes, Kundalini Yoga. It can be a substitute for all the other things that people look for to explore, escape, whatever, you know, to enjoy themselves. Being in a state of bliss is something that we would all love to have. And that's what Kundalini Yoga is really all about. It's about becoming enlightened, becoming aware in ways that we have never been, and to activate our potential. So with that said, let me go to the slides. Right? Yes. They wanted a picture of me, so that's the picture. And there's so much stuff that I could share with you and want to share with you, but because you're able to view things later on YouTube or any format that they present on, I'm going to go through a lot of things very quickly because the richness is in the meditation techniques, but the science that I've done is rather phenomenal. And all the science that I've done is based on the teachings of Kundalini Yoga as taught by Yogi Bhajan. Since there are numerous teachers on the planet, spiritual teachers, or no longer on the planet, that say they taught Kundalini Yoga, that's why we say Kundalini Yoga as taught by Yogi Bhajan. So Shruti went through my affiliations. I'm the director of the research group for Mind-Body Dynamics of the Biocircuits Institute at the University of California, San Diego. I'm also a member of the UCSD Center for Integrative Medicine. Recently, I was, at the beginning of this year, I was invited to be an instructor on the faculty for Psychiatry Redefined, which is an effort to revise psychiatry where it can really help people instead of just pill popping and talking to people. It includes things like nutrition, and they invited me to give a couple of courses already. And then I'm the president of something called the Khalsa Foundation for Medical Science, which is a 501c3 nonprofit public corporation. So I guess it shows up on the left, there's a real picture of Yogi Bhajan, probably I would guess in 1990, something like that. And on the right is his spiritual teacher. So they've joined together in the heavens is Guru Ram Dass, Raj Yog Guru Ram Dass. And I think is an appropriate title, because he really was a great yogi. So I'm a servant of Guru Ram Dass and a servant to Yogi Bhajan. That's my spiritual lineage. And I know it goes back into past lives. And this group is easy to say something like that too, because you don't have the same allergic reactions that a lot of Westerners have. And I'm sure you've all heard of Guru Ram Dass. He was the fourth Sikh guru. And in reality, he became when he was the guru at the time, he was competing with other yogis, siddha masters, gurus and things like that. And he won the crown because he could do things that the others couldn't. They always had these competitions. And he was able to escape into the psyche of the universe where no one could find him. So he was then acknowledged as the Raj Yog. And then he became the guardian for all of the technology that took ages and ages and ages. And we can get into that later, how old it really is. But he became that guardian. And he channeled it through Yogi Bhajan. Actually, I've also used channels to get stuff from Guru Ram Dass, as early as 1993. And then I got stuff from Yogi Bhajan in 2004 after he checked out. So just to give you a quick background about myself, I'm not new on the block. I was invited by the National Institute for Drug Abuse, we call it NIDA, which is part of the National Institutes of Health, in October of 2010 to give a talk. It was entitled Kundalini Yoga Meditation Techniques Specific for the Addictions, OCD, Impulse Control Disorders, and Compulsive Behavior. That's probably the first time they've ever had a talk like that at any NIH institute. And then I presented at the American Psychiatric Association since 2003, 13 times, and 11 of those were full day, 6-hour continuing medical education credits, courses. So they were 6-hour courses. And this one was entitled Kundalini Yoga Meditation Techniques for Anxiety Disorders, including OCD, depression, attention deficit hyperactivity disorder, and post-traumatic stress disorder. So during this full day, 6-hour course, which was 3 hours plus 3 hours with a lunch in between, I taught them about 16 different meditation techniques, all sitting in chairs, and they were blown away by it. And then the same year, I taught on the next day, Kundalini Yoga Meditation Techniques for Schizophrenia, the personality disorders, and autism. That duo, those two courses I did three years in a row. Anyway, so here are my books, Kundalini Yoga Meditation Techniques Specific for Psychiatric Disorders, Couples Therapy, and Personal Growth. I was invited to write this in a professional series. My editor, Deborah Mahmood at Norton. By the way, Norton, W.W. Norton and Company is not a yoga publisher. They specialize in psychiatric disorders, psychology, and related things. She saw a title of a talk that I was giving in 2004 at the APA, the American Psychiatric Association. She asked me, would you like to do a book for us? And I kind of cringed because I know for professional books, you don't get much of an advance, but the royalties are very good. So I said, yes, I'll be happy to do that. And so that was published, I think it came out in 2006. And then afterwards, she says, would you like to do another book for us? And I said, sure, why not? And so I realized that there was a range of disorders that I had not included in the first book. And so this one is entitled Kundalini Yoga Meditation for Complex Psychiatric Disorders, Techniques Specific for Treating the Psychoses, Personality, and Pervasive Developmental Disorders. A lot of the information from that book I got from Guru Ram Dass. And the other stuff I got from Yogi Bhajan. And here's the third book. Deborah Mahmood said, why don't you do a handbook for us where you're just including the DSM criteria, the diagnostic criteria by the American Psychiatric Association, and the protocols, without the case histories, without other stuff that, is informing, on the status of research and treatment for the other disorders. So it's just the DSM criteria and the protocols. So this was the third book that I did for them. And originally she said, why don't you just pick some of the main disorders and we'll do that. And I said, no, because if I want to do a book with somebody else, it's going to compete with this book. So let's do all of the psychiatric disorders. So all the major psychiatric disorders are covered in this one book. And here's the table of contents. There's an introduction to Kundalini Yoga Meditation. I'm going to just read the topics of the various chapters. Anxiety and generalized anxiety disorder, OCD and the OC spectrum disorders that include trichotillomania and body dysmorphic disorders, phobias, panic attacks and panic disorders, acute stress disorder, post-traumatic stress disorder, which is PTSD, the abused and battered psyche, major depressive disorders, grief, bipolar disorders, addictive impulse control and eating disorders, insomnia and other sleep disorders, chronic fatigue syndrome, ADHD and comorbid disorders, dyslexia and other learning disorders, schizophrenia and other psychotic disorders, and then the 10 personality disorders, paranoid, schizoid, schizotypal, antisocial, borderline, histrionic, narcissistic, avoidant, dependent, and obsessive compulsive personality disorder, which sounds like it's OCD, but it's not. It has some similarities. And then autism and Asperger's disorder. Later, they then created a name called autism spectrum disorders, and they got rid of the Asperger's disorder as a title. And then I did a book. I was invited by an editor for the series of International Review of Neurobiology published by Academic Press and Elsevier Scientific Publications. And a book like this is a hardback, and it's in this long series. I did volume 80, and there's probably been 60 volumes since then or something. But normally a book like this is, has 3 editors, and then you invite people to write chapters. Well, I wrote the whole book for psychophysiological states, the ultradian dynamics of mind-body interactions. So it's a very prestigious series. But it's also a very expensive book, but maybe a library that has it that you might want to get it from. So in 1976, when I decided I wanted to start doing research on Kundalini Yoga, I came to one of my colleagues. I don't know if you can see my mouse moving. Can you see it?
Yes.
Okay, great. Floyd Bloom, before he came to the Salk Institute in 1975, was the director of St. Elizabeth's Hospital, which was the largest psychiatric hospital in Washington, D.C., affiliated with NIH. So he was a big shot. He was at Salk from 75 to 83. Then he went to the Scripps Research Institute, and I didn't go with him, but I was affiliated with him while he was at Salk. And Deborah Wernz, who was a co-author, the primary author, she did this for her thesis. She knew me, and she came into the lab I was working in, and she said, do you have any ideas for a thesis? And she told me she was in Reginald Bickford's group. And I said, yes, I do. Give me 15 minutes. We'll go out into the courtyard and I'll give you this topic. And I told her that the two hemispheres of the brain alternate in dominance, and it's coupled to something called the nasal cycle, which probably most of you are familiar with. When you're breathing through one nostril more than the other, and then it switches back and forth. Some of you may or may not know that the two hemispheres of the brain are alternating in dominance. Doesn't mean that skills shift from one side to the other, just means that one hemisphere dominates more than the other. And everything that we do is affiliated with that. And so you can see from this, there's three subjects here, G, F, P, C, and JW. Down here is a time marker of 15 minutes. So what we have here is airflow, which means it's right nostril dominant up here, left nostril dominant, right nostril dominant, and left nostril dominant. This is like an idyllic pattern. And you can see that the patterns of Toll-E, G, and the different frequency bands of alpha, theta, delta, and beta are tightly coupled to the nasal cycle. The same is the case down here. And here's a woman that it was about a 15 or 25 minute cycle for her with her nasal cycle. And we looked at her again, and she was more like one of these subjects. But this was something that was completely unknown, that the two hemispheres of the brain alternate in dominance. By the way, I was in India one time in 1987, and it was in Madras, Chennai as it's now called, and it was for the first International Conference for Energy Medicine. And Swami Vishnu Devananda got up and spoke before me, and he said, you guys should do this study. And then I got up and spoke, and I had the data and it was all published. He was kind of blown away and saw, oh, Yogi Bhajan's student beat to this. You know, there's a little competition in this spiritual arena, all right? And so he was impressed. And then I got invited at that meeting by Swami Vishnu Devananda to go to Trivandrum. I don't know if the name has changed or not. And with about 8 other people, and we all gave talks at his ashram in a big symposium that he put together very quickly. And I was also invited to Nimhans to talk on this work as well. At the same 3-week period that I was there. These are just my clinical publications for OCD, and I don't really want to go through them here. And because it takes too long to read them, and you can come back and look at them, but I'm going to share some data with this one, 1999 one. And here's more of them. And this last one came out in 2019. It was a study done in Brazil. And the person running the group was a student of mine, Rodrigo Jacobian Fernandez. He came to UCSD and he met me. And there's a long story there. And the story of how this study unfolded was fantastic. But these are details that you don't really need me to go through now. And then there's unilateral forced nostril breathing. I told Floyd Bloom about this in 1976. And he wasn't prepared to believe that forced nostril breathing would have a differential effect on the hemispheres, or that there would be any difference between the two nostrils. But after the weekend from the Friday when we spoke, he was convinced that the nasal cycle was exactly what I said it was. So I was probably the pioneer of this work in the new age of research on unilateral forced nostril breathing. I did the initial studies. Other people followed me. Being a pioneer is great, but at the same time, you have more roadblocks ahead of you than anybody else who sort of follows on. So we use I've used unilateral forced nostril breathing to show the differential effects on the two hemispheres with the EEG, MEG, which is magnetoencephalography, which is far more sophisticated than EEG. And we also did studies, cognitive studies. And essentially we showed that that left unilateral forced nostril breathing reduces heart rate compared to right unilateral forced nostril breathing that increases heart rates. Others have shown differential effects on blood pressure, eye blink rates, interocular pressure, glucose, and probably some other things by now. So unilateral forced nostril breathing stimulates the ipsilateral. If I'm forced breathing through the right nostril, it's going to stimulate sympathetic tone on the right side of the body. And that means that the parasympathetic tone on the left side of the body will then dominate. And there's a model for a hypothalamic regulation for all of this that I published in, I think, at least 2 different places, and I'm working on another paper with that right now. So here's the reviews. Yeah, I guess there was 3 places where I published the hypothalamic model. But here's reviews. I was the first to write reviews on this. There's one other that I didn't include here, but I'll show you one of the yogic pranayams that's relevant and has to do with stimulating the immune system, because it's very pertinent to these days, because we're now dealing with the COVID virus, right? All of that stuff. And if there's a yogic technique to stimulate the immune system, strengthen the immune system to fight viruses and bacteria, it would be very, very important. But the book I showed you on psychophysiological states reviews the stuff on unilateral forced nostril breathing and all of this laterality business with ultradian rhythms. And then I published in 2007, which was 8 years after one of the CNS Spectrum's publications on the OCD stuff. It's in the same journal. So I don't want to spend much time on this, but this came out in Human Neurobiology 1987 with Deborah Wernson and Reginald Bickford and myself. So baseline shows that the right nostril airflow is the dominant at this point. And then, and you can see it sort of straddles the midline, but with left nostril breathing, it brings the power of the EEG into the right hemisphere. It means the right hemisphere is more active during left nostril breathing. And right nostril breathing brings the EEG power up into the left hemisphere. And so left brings it back down. And there was a rest period. And then we repeated things. I don't want to go into those details too much because this is just some background. So the idea is, you've all heard of right and left nostril breathing. I know that. And some of the more, what I would call simpler pranayams. But until my work, I don't think that, in case you've seen some of it, I'm sure that you've never seen what Yogi Bhajan called the OCD breath, which is when you perfect it, you're breathing selectively only through the left nostril at a rate of 1 breath per minute. It's got 4 phases. You inhale slowly for 15 seconds, hold the breath for 15 seconds, slowly exhale for 15 seconds, hold the breath out for 15 seconds, and you repeat that for 31 consecutive minutes for 90 days, and it cures your OCD. And it'll put you through a huge transformation in any case, okay? So that's the OCD breath, and it's probably the most difficult pranayama of all to do, because you're breathing at 1 breath per minute. And when you have holding the breath out periods that last for 15 seconds, that's a long period of time. But everybody that's perfected it has completely cured themselves. But it puts them through a huge transformation. And this is a very simple diagram showing the OCD breath. Here's with the data so smooth that you'll see gross differences. But this is the left hemisphere. This is the right hemisphere. This is 10 minutes of resting baseline before in both hemispheres. They look nearly identical. And the 10 minutes of resting baseline afterwards also look almost identical. But what you see here is that the left nostril breathing, which is the OCD breath, has a much more profound effect on the right hemisphere, right? You don't even have to study that. It's just visually apparent. So there were 3 clinical trials that I've done. This one was a pilot where we just, we had no control groups. And it was published in 1996. It was actually done in 92 to 93. These things are not easy to publish, believe me. I could tell you nightmare stories of the difficulties and the resistances that I've had to deal with. So you can see Y-BOX is the Yale Brown Obsessive Compulsive Scale, is sort of like the gold standard for looking at OCD. And you can see the 0 month, 3 month, 6 month, 9 month, and 12 months difference. So there's a scale of from 0 to 40. And this group was not bad. It had a mean at baseline of 21.15 and at the end 8.8. But nobody else has ever brought down the final endpoint to 8.8. So that's, I don't want to show much more of that. And it's just, this is the randomized controlled trial that was funded by NIH. And you can look at the patient demographics and you can see that they're almost identical in every regard. And what we use as a control group, everybody was blinded as we told them there's 2 different types of meditation that we're going to be teaching. We didn't name them. They were blind to what the types would be before they entered. And after they did enter and they were randomized, and before they, or after they got into their group, then they got the names. So Kundalini Yoga was group 1, and Kundalini and group 2 had 30 minutes of the relaxation response and 30 minutes of mindfulness meditation to equal about the hour of the protocol here. So the baselines for the Y-BOX are nearly identical, which is, we were very fortunate to have scores that were 22.75 for the mean severity of the Kundalini Yoga group and 22.8 for the RRMM group. So that's Y-BOX, and this is perceived stress scale. So they look nearly identical, and essentially there's absolutely no difference. And then after 3 months, you can see that there was the score, the means, the 0 months changed because we lost 3 patients from each group. So actually, with the patients that we had 7 and 7, there was a change score of 9.43 for Kundalini Yoga and a 2.86 for RRMM. So there was a big change for Kundalini Yoga and a small change for RRMM. But when we do in within groups differences, there's something profound. It's not the most rigorous type of statistical analysis, but you can see in Kundalini Yoga, all the p-values were less than 0.05. And for RRMM, none of them were significant. So that in itself is sort of striking. In fact, some of the scores were negative for RRMM. Here's the completers that went through 15 months of Kundalini Yoga. And you can see that they go down. And here, 6.6 is the mean score for those that were completers. These details are in publications that I could send you if you asked me for them. And then there's this study that was published in 2019, done in Sao Paulo, Brazil, with collaborators from the University of Sao Paulo in Brazil, one guy who was from Duke University, Duke School of Medicine in the United States, and another from Yale. All of these guys, except for me and a few others, 5 of them are world-renowned clinical research scientists. So that's published in Frontiers in Psychiatry. And you can have that for free and go through it. It's kind of boring because it's long and very difficult and complex. But I'm just trying to give you some background. I'm not going to read the abstract because it's just too detailed, but it's here and you can read it on your own later or get the paper. But here's some of the data for the Y-BOX. KY and percent intent to treat analysis. KY% for the completers, and then RR. For this group, the only control that we had was just the relaxation response. And you can see that for an intent to treat analysis, it means that you take the baseline score for all those that dropped out and take them forward to the next endpoint, your final endpoint. So you're using scores of people that were scored in the beginning, but they're just brought forward. So it's a super rigorous analysis. But then the completers are what we normally think about. What was the completers improvement? So we had like a 40% improvement for those patients in the first 4.5 months. So it was a 0 time point and then 4.5 months. And then we collapsed the groups. But here's something called the dimensional Y box, which is a newer version. And you can see that things look pretty similar to the Y box itself, but it's like there's very little blue on that page. So this test, which is more sophisticated, although it's not as common, it's still going through, gaining its recognition. But the scores were like near 0 for RR group. And here's with the other scales as well. This is the intent to treat, excuse me, whoops. Intent to treat. Where is my map? And then the completers, again, for the profile of moods, Beck Anxiety Index Scale, Beck Depression, and then this was a survey, a health survey. This was actually, there was no significant difference between these two. So there's 7 scales in here, and there's one of them I'm leaving out just to leave out. But 6 out of the 7 scales, there was Kundalini Yoga was far superior than the control group. This is a patient, that you can read this later on your own. But it was a patient in the trial that we just went through, the last one, the Sao Paulo thing, and it was her patient's perspective. It was going to be published. We didn't publish it because the journal rejected our article. They didn't even want to send it out for review. The politics these days in science is horrendous. And this is another one. This was actually an Indian fellow from that lived in London that's a doctor, and he wrote this one, but this is another one you can read on your own. All right, so the individual meditation techniques in this system were originally taught by Yogi Bhajan, a master of Kundalini Yoga. The 11-part OCD specific protocol was created solely by David Chanoff-Colson in 1992 and includes a copyright. The photos of myself have copyrights. But I put this protocol together. In 1992, I was invited by somebody in the Department of Psychiatry at UCSD. She wanted to do a study where she just used the OCD breath. And I said, no. That's the most difficult pranayama of all. She was another yogic lineage by Swami Muktananda. And she thought she would get permission from her boss just to include long, deep breathing, abdominal long, deep breathing. And her boss told her, well, look, we've got these publications that David put in one of our mailboxes, and why don't you look at it? And then she saw this technique specific for OCD. It sort of blew her mind. It was Kundalini Yoga versus Kundalini Yoga, but there was a technique very specific for OCD. It was published in a chapter that I wrote for Marcel Decker. The title of the book was Stress, Neurobiology, and Neuroendocrinology, and it had, I think, 7 different pranayams that were highly structured and very different. So we did that, and that's when I put the protocol together. And 3 to 4 months into the study, I asked Yogi Bhajan what he thought about it. He said, send it to me, I want to look at it. Then he called me back and he said, it's fantastic. Why worry, So that's the protocol. It's got all of these techniques. We're tuning in to Om Namo Gurudev Namo. It was a spine flexing technique, a shoulder shrug technique, both give vitality. Then there were 3 techniques for anxiety disorders. The chill out, a technique for managing fears, the OCD breath, a technique for meeting mental challenges called the victory breath technique, and a mantra to turn negative thoughts into positive thoughts. That I'm going to teach you. And then the mantra for tranquilizing an angry mind. Having a mantra is specific for treating anger. And if it's easy to do and not difficult like some of this other stuff, people pay sometimes like $28,000 to go to a cognitive behavior course, residential course for treating anger, using cognitive behavior therapy. And so if you have a technique that can chill out a red hot angry mind in 11 minutes, that's worth something. I taught it to them just in case it came up. So I taught it to them once, and then we did it once in the group because it seemed like people were kind of angry. Here's tuning into Om Namo Gurudev Namo. And it's a mantra where your hands are together in what we call prayer pose. Let me go down to, I rented that guy for to help me take pictures. You know what here's a joke. I was at an American Psychiatric Association meeting and somebody said, "Oh, I went to your course in Minnesota." And my eyes kind of started rolling. And I thought, okay, I know who he's talking about. But then I said, guys with turbans and beards all look alike. Anyways, it was kind of a joke, and it's one of my favorite jokes. But that's the posture. I'll chant it for you very briefly once so you can see it. It goes just like this. Half breath through the mouth. Gurudev Nama. What it does is it plugs you in. One of the analogies that Yogi Bhajan would use with it sometimes is that he would say, you never try and turn on a fan without plugging it into the wall first, do you? Of course, no one would do that, right? And we don't do Kundalini Yoga unless we're plugged in. And you can only get plugged in where you're plugged into an energetic field, which is really the golden chain of teachers in Kundalini Yoga, which in reality means we're plugged into the subtle body of Guru Ram Das. And when Yogi Bhajan was on the planet, it would first go to him and then to Guru Ram Das. So being in a field of absolutely pure and powerful energy, where you could get as much as you could manage, but not too much, and never have darkness come near you, is what happens when you chant this mantra. Dark entities can try and come to you, but they see the field and who's in that field, and boom. Most people never have that kind of experience, but it happened to me with a woman who had been possessed on occasion. And she was very active at her third eye. And after she tuned in with me, and then doing a few techniques, she saw this entity coming towards her that bothered her had been bothering her for a couple of years. And then after this time, it never, ever came back to her. So there are benefits of Om Namo Gurudev. It's not a ritual. There are no rituals in Kundalini Yoga. All right, here's a left nostril breathing technique to strengthen the immune system, to fight viruses and bacteria. This is your left hand, my left hand. Let's put right here. I'm going to go through these things very quickly. And then you collapse the fingers. You plug the right nostril and you do breath of fire. We call it breath of fire. You call it Kapalabhati. And it goes just like this. for 15 minutes. And then when you're done, my arms are raised, but they should really be right in front of my heart center. So I don't think you can see that far. Then you inhale. Pull real hard. Hold the breath. Exhale and do that 3 times. That stimulates the thymus gland, which empowers your immune system as well. But the 2 hemispheres of the brain have differential effects on your immune system. Most people don't know that. I happen to know one of the guys that did that work. It all came out of France. So you can see why I'm sharing this technique, because it's so relevant to our time. When the whole business started, I did this for about 2 months every day, or almost every day, just to empower my own immune system. No one wants any kind of infection. In fact, I haven't had a flu or a cold in 10 years. All right, here's a mantra. We call it Long Ekankar, or the Adi Shakti mantra. And it was the first mantra that Yogi Bhajan taught. He was told, don't ever teach it publicly. So he, of course, the renegade that he was, he taught it. It was the first mantra. He taught it even before he taught Sat Nam or Vaheguru. And so when it's done, what it does is it stimulates all 8 chakras. It balances them, it integrates them, it heals them, it slowly opens them. So, if you were to choose one mantra alone for the rest of your life, this one would be ideal. And it's explained, I'll do it once for you. It's a 2.5 cycle breath. You inhale first through the nose, it goes like this. Full breath through the nose. Sat Nam. Steady. Half breath through the mouth. Wa. Hey Guru. You can do it 3 minutes, you can do it 7 minutes, 11 minutes, 31 minutes, 2.5 hours, or up to 72 hours. I think I've done it 5 hours in the past. But normally it's done for 2.5 hours. And on Yogi Bhajan's birthday, which is August 26th, he was born in 1929. We would do it, we'd get up before the sun and do it before the sun rises for 2.5 hours as an honor to him. And of course, we got blessed for doing it. Super powerful mantra. It's fantastic. All right, the details are there. You don't need me to read them for you. All right, this one is for insanity, I think. I can't see the thing. Yeah. All right, let me move this thing over. I can have a better look at my own slides. Meditation technique for insanity. It's part of the OCD protocol. There's a number of elements to it. Let's not read it. When you're really emotional, there's 2 things that you do. You talk, or eat. And because you want to stimulate your temporal mandibular joint, which is related to an area of the brain that's related to your emotions. So you want to stimulate it. That's the only way you know how to stimulate it. So with this, you have your mouth open wide. You're stressing that joint. And your tongue tip is touching the roof, the hard, smooth surface at the top. Your eyes are focused here at the tip of the nose. And we call that Ajna Bandh. Ajna, Bandh. Bandh means lock. Ajna means mind. So it means mind lock. So you're having an effect on the frontal lobes of both hemispheres. You're normalizing the frontal lobes. It also affects your pituitary very differently than when you're looking at the third eye or looking at the top of your head or looking at or trying to look at the dimple area of your chin. So there's 4 primary eye postures in Kundalini Yoga. So this one, you're breathing slowly in and out through the nose only. We would do it for about 6 minutes. If you know somebody who's absolutely gone insane, you can teach them this after they tune in. You always want them to tune in because then they have the power. Then they're plugged in. They have the protection. They have all the energy and they can never get too much energy because it's balanced in a very unique way. All right, let's see. All right, here's the meditation technique for anxiety. It's called, Yogi Bhajan gave it a nickname. He says, if you don't know what to do, do this meditation. Because with 5,000 different meditation techniques, sometimes your head can get scrambled. Which one do I do? And he said, the original name was Gyan Mudra Kriya. When you don't know what to do. So there are 4 breathing patterns. Open but focused on the tip of the nose, which you cannot actually see. You know, when I do this, I see blurriness on the 2 sides. It looks like a blur on the 2 sides of my nose, but I cannot see where I'm touching, right? So let me go to the hand posture. Hand mudra first. That's it. When you do like this, you'll do one arrangement more so than the other. You'll either do that or you'll do that. One's comfortable for you. So just find out which one you do. All right? Like that. So that's the hand posture. It's 2 to 3 inches away from the chest. Elbows are resting at the ribs. That's the guy from Minnesota, I think. I'm making a joke. All right, so where did all right. You inhale and exhale slowly through the nose only on the first breath. Then you inhale through the mouth slowly with the lips puckered. And then you exhale also through the mouth slowly. All of these are slow. Then inhale through the nose, exhale through the mouth slowly. And the 4th breath is inhale through puckered lips, exhale through the nose. So in the nose, out the nose, in the mouth, out the mouth, in the nose, out the mouth, in the mouth, out the nose. It's very profound. It's easy to do. This is a simple thing. There's nothing difficult about it. The only hard part is a little bit with the eye posture. Otherwise, everybody can hold their hands here. They're not touching the chest, but it's 2 to 3 inches out from the chest. And, you know, like that. All right? Next one. That's just more about it. It describes more about it. All right, here's a very highly structured pranayama. You all know about left nostril breathing, right nostril breathing. But this one, for 9 minutes, you do left nostril breathing. But for the first 3 minutes, it's 4 parts in, 1 part out. Eyes focus at the 3rd eye. Spine is straight. Neck lock. So 4 parts in, 1 part out for 3 minutes. Then 8 parts in, 1 part out for next 3 minutes. Then the last 3 minutes for left nostril breathing, 16 parts in, 1 part out. This is a mildly advanced pranayama. You could probably do it, but it might make you sweat and put you through a lot of changes. Then the second section is the same pattern, but then you're doing it through the right nostril only. All right? 4 parts in, 1 part out. 8 parts in, 1 part out. 16 parts in, 1 part out. And then section 3 is the same thing, but you don't block either nostril. And it doesn't make any difference whether you're right nostril dominant or left nostril dominant in any part of this. And then the last part, the last section, is you relax the hands in the lap. You curl the tongue in a U shape, like that. And you inhale 4 parts in. Wait a minute. Curl the tongue in a U shape and extend from the mouth. Inhale in 4 parts in. Close the mouth. Exhale in 1 part out the nose for 4 minutes. So that makes 31 minutes. I'd say, do you have any questions? But we're going to hold them off. So here's a meditation to manage fears. Obviously, I threw this in with the OCD patients because their root cause is they have a fear of death and they don't understand why they do or what happened. It's all a past life event that created the condition in this life. The average age for most people that develop OCD for the onset is age 10, but it can happen in your age of being 50 as well. But so let me show you the picture. See my left hand, I'm taking these fingers and I'm plugging it right into my belly button. My right hand comes up here and I'm touching right where if you have a fever, the doctor comes and puts his hand like that to feel your fever. You know, so what you're doing is you're creating a circuit from the navel to the pituitary, all right? And let's pretend I'm an OCD patient and I have the fear of being contaminated by toilets or something. So I'm sitting like this when the music is playing, focused at my third eye, and then I image the fear. Let me play the music for you, which goes on in the background. There's this one special mantra, Chatra Chakravarti. It's actually from Japsa, the creation of Guru Gobind Singh. Can you hear that?
Yes.
Okay, you get the idea, right? You know how I learned the benefits of this? A woman, I had never used it clinically before. And I can't even remember if I used it for myself. But a woman came to me, she was dying of cancer. She had come to me a year earlier. And she didn't follow instructions. And she eventually went to 9 surgeons before she found one that would do a lumpectomy for her breast. 9 surgeons. So that tells you she was a little bit on the neurotic side, right? So she comes to me at this point. Not only did she had the cancer had metastasized to her liver, her bones, her lung, and her brain. She says, David, is there anything you can teach me because I have the fear of death? And her husband, we were sitting at a table. Her husband is sitting there, and I'm sitting here, and she's sitting there, and we do it, and he's just watching. You know, we did it for 3 minutes after tuning in, telling them about Gurudev Namo, and he looks at her while she's doing it, and he sees she starts to smile. And at the end, he says, honey, I haven't seen you smile in 2 or 3 months. And she said, my fears were disappearing. So of course I decided to include that with the OCD patients, all right? So there's 2 versions of it. One with Wahguru Kar and Kulwant Singh. The one you can find, the one I recommend at this point because it's on CD, you can find it online. Google Kulwant Singh, Healing Sounds of the Ancients, Collection Volume 1. And you should be able to find it and download it. But this is invaluable. To deal with fears with so little effort, OCD patients would either start with the little fears or their big fears, but believe me, they knew that this technique worked. 3 minutes. What's easier than that, you know? All right. All right, turning negative thoughts to positive thoughts. This is the most powerful mantra in all of Kundalini Yoga and all of the Sikh teachings as a single, what we would call a mantra. Ek Onkar Sadguru Prasad, Sadguru Prasad Ek Onkar. What that means, one universal consciousness comes to you by the blessings of the Sadguru. All right? Because you really don't get enlightened all by yourself. The masters, either here in the physical realm or in the etheric realms, they're helping you. Ek Onkar, that state of universal consciousness comes by it's the prasad, it's the blessing of the Sadguru. All right, got it? So the mantra goes like this. You're sitting with your eyes closed, hands in the lap, spine is straight, and it goes just like this. We would start out doing it once, but then when they get good at it, they can do it like this. Ek Onkar Sadguru Prasad, Sadguru Prasad Ek Onkar, 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 Ek Onkar Sadguru Prasad, Sadguru Prasad Ek Onkar. You can build it up to as many times as you can do it, but 3 to 5 is good. Once in the OCD clinical trial, or a couple times, just for a change of pace, instead of doing it for 5 minutes, we did it for 11 minutes. There was one woman who had hoarding symptoms. She was a 30 on the Y box when she started. She was a 10 when she stopped. She stopped early because she ended up breaking a leg and she couldn't drive the car to get there anymore. But she went through about, I think, 2/3 of the program. And one day we did this mantra for 11 minutes. And she was 60 years old. She said, you know, when we're done, she said, David, I feel like I have like a golden halo around my head. And I said, you probably do. It put her into a state of bliss. It's the most powerful mantra there is. But one has to chant it with reverence. All right? So, negative thoughts to positive thoughts. That's what it does. OCD is nothing but negative thoughts. The fear of this, the fear of that, fear of other things. And those things can mutate over time as well. Somebody can start out with fear of contamination and then they end up with checking only or checking and hoarding. All these kinds of things. All right. Chanting meditation to tranquilize a red hot angry mind. Goes just like this. Geo, 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 non-stop. You just do it real quickly. It's not like you take a long breath. So let me do it without choking. Do it again. Geo, 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 geo. My throat's too dry, but you get the idea, right? Is that easy? Geo. Your tongue will feel like it's getting tongue-tied. You can't pronounce the words, but just tough it through. Do 11 minutes. Do the best you can for 11 minutes. One time I did it twice in a day. I can't look like I'm an angry person with my colleagues or with anybody, right? It doesn't make sense. You do yoga and you're angry. So before I left the house once, I was going through a divorce. I did it. And then when I came back, I had to do it again. But the residual effects last about 3 days. It's like a medication in that effect, depending on the severity and how well you do it, and then how often you need to do it. All right, a technique for curing addictions. Wouldn't it be great if we had a meditation technique specific for any and all addictions? See that? That's what's his name again. He's putting a mild, he's not pressing in, it's just lightly touching this very soft area. It's these soft spots. If you push on those soft spots, it hurts. It's painful. So the hands are like that. Now you see the posture. Let's go back to the instructions. And what you're doing is you're using this mantra, Sata Nama. So your mouth is closed. Your eyes are focused at the third eye right here. Some people think the third eye is up here. It's not at all. And I can always tell in class when somebody's not really listening to me, and they're doing it, and you can see the whites of their eyes down here. So you know that they're focusing up here instead of here. This is like a point. You can either look at that point or you can imagine a point on the horizon, right, where the sun is setting or the sun is rising. It's a point out in the infinite realm, so to speak. So you're doing this. Your molars are clenched, but not tightly, and you pressurize it and go like this. And mentally, what you're saying as you clamp down, clamp down, clamp down, clamp down, without grinding your teeth, mentally you're vibrating the mantra, one sound with each clamp. So it goes sa, ta, na, ma. Of course, it's silently, and you're not really opening and closing the mouth. You're just keeping the whole thing closed. That's it. If you can do 5 to 7 minutes in the beginning, fine. But look, don't put your thumbs like this. Put the thumbs like that. The soft pad part. I'm going to teach you something very interesting. Go like this. See how much you can bend. Do you know what that tells me? Or will tell you? You know what that is? That shows you how flexible your ego is. This is a teaching of Yogi Bhajan. If you're like that, you're very, very inflexible and rigid. If you bend too far, I'm almost too far, it means my ego is very flexible. Better it should be flexible than not flexible. Interesting, right? All right, so that's just something about your thumbs that I threw in here. He taught us so many things, it was unbelievable, critical to our lives. He taught on every topic there is, from one end of the spectrum to the other. So the problem with this technique is, let's say you're a drug addict or an alcoholic. By that point, the nervous system has become rather weak. So if you can even get to 5 or 10 minutes holding like this, that's good, that's great. So it becomes painful, physically painful to hold the arms up because the nervous system is weak. All right? But that's an invaluable technique. And he said this meditation is one of a class of meditations that will become well known to the future medical society. Meditation will be used to alleviate all kinds of mental and physical afflictions, but it may be as many as 500 years before the new medical science will understand the effects of this kind of meditation well enough to delineate all of its parameters and measurable factors. So, I mean, he goes on and says things about it, but I want to go through more things, All right. Do you want a meditation technique to develop supernatural powers? Here's one. And it doesn't have any special name, but what Yogi Bhajan said about it was Egyptians used to do this meditation for supernatural powers. These are very secret, sacred meditations. Some of you, out of your sheer devotion and love, may pick them up and master them. Your elbows will want to separate. Your thumbs will want to be loose. Your breath will revolt, and you're going to fight against every odd. Begin by practicing 5 to 11 minutes and slowly build to 31 minutes maximum time. You can see by the pictures, right? All of this, what the business is like. I've done this. I built it up to 31 minutes. I didn't do it forever. I did it for a while. There's so many things to choose from. And it is painful, but the more you do it, the less painful it gets. But let me add one thing to it. There's a saying, I think it's in Sri Guru Granth Sahib, Tattva Siddhi Atma Jnanam. It means those who practice the siddhi that relate to a tattva, one of the five elements. If it's anything, at least for us in our lineage, the only power we can develop and use freely and whenever we want is the power to heal others. Never to materialize anything, never to use Bhak Siddhi where you say something and you know when you say it, it's going to have an effect and whatever you said is going to occur. If somebody said, oh, go break a leg, and that person goes and breaks a leg, that's because that person had Bhak Siddhi and that happens. It's happened to people. So the siddhis in natural, and that we know about, I think there's 9 or 18 siddhis, different siddhis. But the only one we're allowed to do, or our body will physically degenerate and come apart, there's the only siddhi we're allowed to do is to heal others. And that's how it should be in reality. Because otherwise...
Yeah, David, could you please explain the mudra once again? The picture is not very clear.
All right. Elbows are together, all right? The instructions are there, so that's why I left it like that. But I'll go through this one. Elbows are together, hands are like this, thumbs are staying up, and the fingers are closed in. And you're putting a mild pressure on it. And what does it say about the eyes? Focus the eyes on the tip of the nose. So your eyes are open, focus here. And then there's the breathing pattern. But the mantra is Ad Sach, Jugat Sach, Habe Sach, Nanak Hosi Be Sach. There's another version of that mantra, Ad Sach, Jugat Sach, Habe Sach, Nanak Hosi Be Sach. But this one is Ad Sach, Jugat Sach, Habe Sach, Nanak Hosi Be Sach. You mentally vibrate it. Are those instructions clear? Oh, this was another pranayama. It's an easy one. Easy to explain. But the descriptions are there. People can read the details. It's 16 parts in and 16 parts out. Through the nose. Eyes are half closed, focused on the tip of the nose, at Ajnaban. The end you cannot see. And your hands are like this. Males grasp, I think I'm not sure if I have a picture with this one or not. No, I guess not. But it's pretty self-explanatory. But this is good to regenerate the central nervous system. When Yogi Bhajan Tataji says it's good to help reverse the effects of alcoholism, but it will also make you super intuitive and heal your brain. So what I'm trying to give you is a sense that the science of pranayam, he must have taught us at least 100 different pranayams, if not more. And the hardest ones are ones that are 1 breath per minute. I'm not sharing that except for the OCD breath. And I've done them. I have done pranayams for 2 hours and 31 minutes, 1 breath per minute. And they have the most profound effects. All right, here's one. What does it say? It's meditation to control death. All right. I don't know if I need to read it to you. You can read it, and because I want to get us to get through this so that we're done. But it's very self-explanatory. All right. So let me just go through this one by showing you a meditation to control death. All right. The eyes are 1/10 open, or it's 9/10 closed as well. You can see the hand mudra. Mentally focus on the third eye point, but your eyes are 1/10 open. Deeply inhale, completely exhale. Hold the breath out while you mentally vibrate the mantra Sata Nama continuously 4 times. This mental mantra is used to time the breath as it is held out of the lungs. This period of time should be the same each time the breath is held out. Therefore, the mantra must be consistently vibrated at the same time. So you're mentally vibrating sa, ta, nama. The meaning of sa is ta, na. It's like satanama. I mean, it's like sadnam. But we call this the Panch Shabad. It's the five primal sounds: sa, ta, na, ma. The vibration of sa gives you the experience of the infinity. Ta gives you the experience of the totality of life. Na gives you the ability to conquer death. Ma gives you the ability to resurrect and be reborn. Infinity, life, death, and rebirth. It cleans the garbage out of your subconscious. Our problem is that we have all this garbage in our subconscious because everything that we ever experience impacts our subconscious mind. And that ultimately creates blocks and things that become hindrances to us. So we have to clean up the subconscious to have some kind of foundation to dwell in a normal state of consciousness and then to dwell in a higher state of consciousness. Because if you go into a higher state of consciousness, boom, like that, you're going to freak out because you don't have the substructure to handle it and deal with it. And that's one thing that's perfectly perfect about Kundalini Yoga, is that whatever you do is what you can do, and you can't do more. You can't breathe at 1 breath per minute if I tell you to breathe at 1 breath per minute and you're not capable of doing it, you know? So, I mean, it's self-protected and you're plugged in. I've never seen anyone freak out in a class. At times, actually, there was a time when I was washing a van of mine during my teacher's training, and I was chanting Satanama out loud for about 2 hours or 3 hours. And did I feel super spacey? I wasn't supposed to, but I knew what it meant to feel, you know, disoriented in altered states of consciousness from other things that I had practiced. But so I learned, you know, not to do that. And it's never should be done for more than 11 minutes out loud. All right. I've done it for 2 hours and 31 minutes silently, but it's with a very special meditation that I'm not going to teach you now for seeing auras. All right. So here's another one with the Satanama one as well. Okay. Similar. What does it say? Meditation to become young, powerful, and special, and to sleep. So this is another one. I mean, he taught endless numbers of meditation techniques to rejuvenate. Pranayams will rejuvenate anybody because it's regulating your prana, right? All right, this one is to expand. It's an 8-part breath. So you're inhaling 8 parts in, 8 parts out. If you can curl your tongue like that in a U shape, it goes like this. Eight parts in, 8 parts out. 8 parts are out the nose, 8 parts in through a curled tongue. If you can't curl the tongue, which about 60% of people can because it's a genetic trait that you have. If you can't do the 8 parts in through a curled tongue, you do 8 parts in and out the nose only. Eyes are the third eye. So this is a very simple one, but it's very powerful. It used to be one of my favorites until I learned more powerful ones. And then if you're done with this, you do it for 31 minutes or 11 minutes, something like that. 31 is the maximum time. When you're done, then you take 3 long inhales and exhales. And on the last one, you hold it out. Hold the breath out for a minute. And you know what that does? Because part of your brain says, oh, it's an emergency. I need to take a breath. But consciously you're doing it. You don't panic. Yogis discovered that was how to treat solid tumors. Because your hypothalamus will go through changes where there's a certain center that gets activated that sends an emergency signal to all of the other systems to help reset them. And one of them is your immune system. So I've taught it to cancer patients, and we are successful with it. All right, so that's one technique. Here's another one. I'll let you read through it on your own later. It's when the body doesn't recognize that it has cancer. It's pretty straightforward reading. There's, what is it, 3 parts. And then there's my website, sacredtherapies.com. It has a very cheaply rentable video for PTSD. And for like 99 cents a day, or $6.99 for a week, or I think, what is it, $29.95 for a month. You can watch it as many times as you want. When you get up to the $29.95 thing, then you get a shorter version of it too, without all the teachings and the hoopla with it, you know. So I'm explaining this, I'm showing the books, blah, 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 as an introduction. So you get the long version and the short version. And then you can rent it for 3 months, you can rent it for 6 months. For 6 months, you can have it and watch it a zillion times for $119.95, and it's super powerful. It'll work for anxiety, it'll work for depression, it'll work to stabilize your mind and to heal you in many profound ways. When I was doing it, just to practice it before I got to the point of filming it, I used to say to myself, I had to do this one more myself, but I've never had PTSD. So it also, there's a video on there for ADHD and comorbid disorders. Then my Internet Yogi is an older website where I sell a DVD for the entire OCD protocol. And then in January of this year, 2021, I was invited by James Greenblatt, who's a psychiatrist who developed a new website and program called Psychiatry Redefined. He wanted me to be on his faculty and be an instructor. So I've done a couple of courses for them. And there's my email. So now let's go to questions.
I would like you to elaborate more about, you mentioned this mantra which was given to Yogi Bhajan, and initially he was told not to teach it to anyone.
Oh, Long Ekankars, yeah. That probably is the one mantra that more people in 3HO, Kundalini Yoga students, have chanted than anyone else. I mean, it can really take you into a blissful state, because the foundation of our consciousness is really our 8 chakras. In this system, as taught by Yogi Bhajan, we consider the aura as the 8th chakra. First chakra, if you live in the consciousness of the first chakra, and which many, many, many millions, if not billions of people are doing these days, it's survival mentality consciousness only. They're always looking to survive, you know? Imagine it's during a war. So everything they're doing is to survive. Second level of consciousness is about reproduction or sexuality. So many people are stuck in that. They're thinking about having sex all of the time, all right? Third is navel point. I, me, mine. You know, when a dog urinates on a fire hydrant, he's marking his space. So we have a lot of human beings on this planet that are locked into their 3rd chakra, meaning they're about territory, mine, power, dominion, like that. 4th chakra is heart chakra. That's the first of the human level of consciousness. The other 3 levels of consciousness, all the animals have that as well. They have that equivalent. 4th chakra is heart chakra, where you have compassion, you care, you're loving, you begin to become selfless. 5th chakra is when you have Vaksiddhi. You have to be very careful what you say as well. But you can hear what the angels say when your 5th chakra is very open. 6th chakra, 3rd eye, you see the sides, both sides of everything. You see the polarity of everything, and you can see visually into the future. Seventh chakra, you live in the consciousness of the saint, in the purity, and your purity of consciousness, totally. That's what dominates your psyche. And eighth chakra is the aura. If you live in your eighth chakra, the world can pass you by. Does that help explain? So that's what long ekunkars do. They work on all the chakras. They begin to equilibrate them. They begin to open them. You don't become so often open that, oh my God, I'm seeing beyond time and space now. And when I close my eyes, I'm seeing it too. It doesn't happen like that. You get what you can deal with and what you have earned. And, most people are healing things as they go. But it's a very powerful mantra. I mean, when I took teachers training in Kundalini Yoga, it was like 74 and 75, those years. One of the requirements was that you get up for 40 days in a row and do long ekunkars for 2 hours and 31 minutes before the sun rises. These days, teachers training, they only have you do that once. I think I did it 50 out of 70 days in a row. And I loved it, and I've done it longer than 2.5 hours. I think the maximum time I've done it was for 5 hours.
My follow-up question is that this is, there is, in the Vedas, there is no prescribed pace of chanting a mantra. It could be long or it could be short or it could be, 16 breaths, 108 breaths, whatever you can. It's very personal and it's very individual. And number two, so if we call it long ekunkar, it does not become any different because there would be saints chanting it at various paces, long and short, in various ages. And number two, this was not revealed to Yogi Bhajan at first. This was the very first teaching of Guru Nanak. It is called the Mool Mantra, which means
Sonam, this is not Mool Mantra.
The mantra begins with Ekunkar.
Let me share with you what Mool Mantra is. Ekunkar, Satnam, it's in Japji. So that's Mool Mantra. That's very different.
That is the Mool Mantra.
Mool Mantra will stimulate all 84 meridians on your upper palate. All right? So it's part of Japji, but Long Ekunkar or Adi Shakti mantra is different. There are similarities. Like Ekunkar, Sadgur Vasad, Ekunkar. It starts out with Ekunkar, right? But so I just want to make sure that everybody understands that they really are different mantras and they have different effects. I hope that answers your question. Excuse me for jumping in, all right?
I have two questions, one related to the other. One is whether you have seen any adverse effects in practitioners that you have come across who are doing this. And secondly, after some time, a practitioner has to start doing these things himself or herself. So how does he know where he is going wrong? What kind of symptoms can he watch out for? Warn him that he's going wrong.
Ramakrishnan, I've taught a lot of people, hundreds and hundreds of patients, and they always get a great result. And in regular yoga classes, people walk away, they're feeling blissful. The downside to Kundalini Yoga is when you don't practice it. The next day, you won't feel as good as the day you practiced it if you don't do anything. So there really aren't those downsides. I mean, sometimes people can feel some negativity coming up and things like that because they're cleansing. It's putting you through a cleansing process. But it's not a problem where people are freaking out. Oh my God, I'm starting to go crazy or something like that. As long as they're tuning into Om Namo Gurudev Namo and practicing them as they are taught, without being some kind of strange fanatic. I've met people in the very early years that I would teach them, and they would change something around. They altered their meditation. So they got, they felt out of balance. It's like when I said when I was chanting Satanama out loud, I felt really strange after a couple of hours. I was cleaning my car. So when you follow instructions, you get the results.
The second question was, when a practitioner is on his own, how does he know? Are there any indications by which he can realize that maybe I'm doing it wrong?
You know, I'm sure there's a possibility of that, but if somebody can read and follow instructions, they're going to be okay. You know, it's just that you don't try and overdo something. It's like a physical exercise, you know. Don't overstress yourself or don't overstrain yourself. Be reasonable. Be practical. You know, I never felt like I did something wrong or went too far. And one time actually that it comes up, it was with the mantra Ek Onkar Sadguru Prasad Ek Onkar. One of the first times I chanted it. It was great. I mean, it was always great. But after 3 days, I decided, okay, I'm too buzzed to do it again. All right. I got too energized. All right. But there wasn't a bad feeling. It's just that I decided, okay, keep your feet on the ground. You know, so it's like I corrected myself.
Yes, I do have a follow-up question, which is, I don't know if you have read Gopi Krishna's account of living with Kundalini. I was wondering what your reactions are to it, and where you feel that he might have gone wrong, where he would have done right.
Let me give you a little bit of background. The reason I got interested in Kundalini Yoga was that it was in the summer, I think, of 1973. I read Gopi Krishna's book, Kundalini, The Evolutionary Energy of Man. And I was a scientist at that time as well at the Salk Institute in La Jolla. And it seemed like his description of things there was a very strong physical component to it. All right. So I became very intrigued, interested in it. So when I had a chance to do a class, I went and did it. But he didn't, have the mantra Om Namo Guru Dev Namo. It keeps you balanced. It keeps like a lid on you. I don't like to say it like that because then people think, oh, I'm not going to be able to get higher. But you're protected. You get all the energy you can manage, but not more. So people don't freak out in classes. I've never had somebody running out of a class. I never had somebody calling me up and saying, I'm crying, or something like that. Again, the side effect is when you don't do it. You don't feel as good. The symptoms come back. It takes a while to heal from things, and clear out the stuff. We have so much stuff in us that it's unbelievable. Yogi Bhajan also taught what he called and what was always called white tantric yoga. It has nothing to do with sex, has nothing to do with, there's white tantric, red tantric, and black tantric. Black tantric is when you do something against somebody else against their own will. So that's like a dark science. You're manipulating somebody. And then red tantric is all about sex and personalities. White tantric is you're doing this under his umbrella, through his subtle body. And those courses are still taught today, although during COVID, all the courses stopped for almost 2 years now. But I went to 180 of them, and they're all super powerful. They're all great. They're difficult, but it cleans stuff out of your subconscious. He becomes the vacuum cleaner through his subtle body for the garbage in our subtle body. And so the more we had those courses, the faster we would accelerate our growth. But everybody, is starting at a different place. They have a different drive, a different motive, a different physical structure, a different age, a different health status. So people do what they can do. It's like you can teach somebody who's 85 years old to do this one. When you don't know what to do, it's not going to hurt them. They'll do it as best they can, as long as they can. There's nothing threatening about it, It's not like we're asking them to stand on their heads. In fact, in Kundalini Yoga, as taught by Yogi Bhajan, standing on one's head is forbidden. Even though a lot of yogic lineages teach it. But what he told us is it makes the bones freeze and it keeps the crown chakra from opening. besides that it can hurt the neck. What other questions do we have?
Is there any meditation technique or sadhana for rejuvenating your life, as in stagnant life where things are not moving and you are too afraid to change, or things don't change anyway? So there are two parts to it. One is to embrace change, not to be afraid of change, and number two, to invite change so that things happen in your life. Life starts moving.
You know, Sonam, one of the things I wanted to do, but I figured I've got too much here already, that if you ever invited me back, I would give you a list of the 40 poris and the effect of each one from Japji. And there are so many things. All of what you have to understand is all of these techniques are formulas. All of the mantras are a little bit different. You know, there's the name of God in all the different languages, etc., etc. And there's all the different names of God in, you know, the Sikh scriptures, which are the Hindu scriptures and so forth. And for those who are not familiar, that Sri Guru Granth Sahib, which is the living Guru for the Sikhs, it looks like it's a book. But in that, each one of those shabads is a formula. Each one has a different benefit and effect. So I can send you the list. Send me an email and ask me. But you know, what you're really asking me is that, what can I do when I'm blocked?
Pranam, sir. I hope I'm audible to you. My
Yes, you are.
question was, ever since childhood, we are in our formal education system, we are never taught about yoga or say meditation so much. So my question was, how as parents or as family members can we teach meditation to the kids in our families, so that as they grow, they can develop good personalities, they can build their character in a way that not only they are in control of their lives psychologically and physically, but they their actions influence the society in a better way, so that their actions are helpful for the humanity as a whole, not only for themselves.
Sure. Can you teach children is what you're asking me, right? That's the general question. Yeah. Some of these meditation techniques you can teach them. Some you shouldn't. You know, obviously you don't want to. I mean, it might have an effect on them, but they're really not mature enough, and they're not going to do it anyways because it hurt. All right. There's things like shoulder shrugs. They're too young to do that. We're not doing it, but Sonam, you know shoulder shrugs, right? Yeah, it's too stimulating. So without knowing which meditation it is, but they could do when you don't know what to do. They could do the technique for addiction. They could do these ones for anti-aging, you know, but they have to tune in first. You know? But that's actually, you're asking me a fantastic question. Can you imagine what kind of humanity we would have if everybody, as soon as they were old enough, started to do these kinds of meditations or things like that? A baby, if you explain to them correctly, if they're young enough and interesting enough or interested enough, they can learn to control the dominance of their nasal cycle before it becomes sort of locked in. They can go right nostril or left nostril. Otherwise, it takes a long time to develop that skill. Yogi Bhajan had that skill. We would hear him all the time switching his nostrils because he's balancing the prana. But one of the chapters in my book, you know, there's like 3 of those books by W.W. Norton. The cheapest one is Sacred Therapies. There's a chapter in there with 10 techniques. Most of them, I think, are for children that have been abused. So those would be wonderful for them, even if they're not abused. But you have to use some kind of judgment, because you're not asking me, what about this one? Can I teach this one to children or that one? So if you're not asking me which one, I have to give you kind of a bland overview answer. But these, if we could get children to do Kundalini Yoga, the idea is to to raise them as saints, right? And of course, in the Sikh religion, we raise them as soldier saints, so they can defend others and defend themselves. You know the origin of the Kara, right? You know the origin of that? Sikhs at one time had to defend themselves against swords. But so it's a symbol today. But what other questions do you have?
Another question was that on the first level, just when we are introducing kids to such things, can we just ask them to chant Om just for the beginning so that they have this habit of sitting and doing some spiritual practice in the beginning?
You know what I would teach them? You said Om, right? O-M. Well, of
Yes.
course you can teach them that. But we, in this lineage, instead of using Om, we use Ong, O-N-G. So with Ong Namo Gurudev Namo, you don't change it to Om Namo Gurudev Namo. Guru Nanak taught us, you in the place of Om, use Ong, O-N-G, because your head can go into the heavens, but your feet will be flat on the ground. You'll be grounded. And you won't have a tendency to withdraw from the earthly plane and lose your physical possessions. So it can be a path, it complicates one's life from what I've learned, all right? It's fine if you want to just chant Om at the end because you're going. If you know you're going, you can chant Om at the time of your transition. But when we're here on the earth, the physical plane, and we have to have a job and a family and possessions, etc., and we don't want to lose things, and we want to maintain our prosperity. That's why Guru Nanak taught us to chant Ong. We get the same experience in the head, but at the same time, we have an additional experience of being grounded, all right? So it's not my choice, and it's not my opposition. I'm not opposed to anybody chanting Om, all right? But I'm giving you the answer for the question that is asked often, to tell you the truth.
David, I have a follow-up question for that. I want the scriptural reference to where does Guru Nanak say this about Om and Ong? Which part of Granth Sahib or which scripture?
Look in Sri Guru Granth Sahib, okay? Look in Japji. You won't find, he didn't write a paragraph saying to do that, all right? But what you'll find, if you look at the mantras, that we have Ong in place of Om. Ik Omkar, Satgur Prasad Ik Omkar, Ong, Ong, Ong. All the mantras are with Ong.
David, if you see the way Om is written and the way it is written as O and a dot. Dot is a nasal sound. You may pronounce it. So there are so many words which, when you translate them to English, the last syllable could be N or it could be NG because it is a dot. It is a nasal sound anyway. Like Soham. Tomorrow you may say it's Soham. So it's
No,
not really.
there is that mantra too.
And number two, the
But we
is,
I don't know the script, but I know the sound, all right? And I know that that's how the Sikhs do it because it was taught that way by Guru Nanak. So I can't say, check in the Encyclopedia for Ancient Indian Teachings on page 38 of chapter 12, you'll see where he writes with his hand. I'm being silly, but those things aren't written down in that regard. Unless you look at Sri Guru Granth Sahib or Japji, you won't find Om, you'll find Ong.
Again, I will stick to that the pronunciation is Ek Omkar because you may not say Ek Omkar. The root word is Om, and the root word in Sikhism is also Omkar. In Christianity, it is, Amen. In Farsi, it is Amin. So it always goes to A or O with an M with it, because M is the first sound a baby is able to make. Even if he's mute, even if he's dumb, is something that everyone
Right.
can do.
You know where that relates to ma,
Exactly.
mother.
Exactly.
But
Exactly.
I know for a fact, Ong is how these mantras are used. And if you read in Japji, which came from Guru Nanak, and the other Shabads in Sri Guru Granth Sahib.
Japji, I have read extensively all my life. I don't find any reference to this Om being pronounced as Om. The remaining Guru Granth Sahib is huge. Which part? That's why I said which part of Granth Sahib.
What can I say? You know, that's what Yogi Bhajan taught us. And all the mantras that have Ong or as the variant of Om, it's O-N-G. Whether you spell it, regardless of how you spell it, the sound is Ong, Ong, Ik Ong Kar. You won't find Ek Om Kar in Sri Guru Granth Sahib or in Japji, at least from my experience.
I have a couple of social questions. So, where do you situate this lineage by Yogi Bhajan relative to all other lineages, both older and younger, in terms of yogic meditation and chanting?
Let me get down to brass taxes. First of all, Yogi Bhajan is not a guru, and that would be one of the things that would have offended him, to no end if somebody called him a guru, because it's so important for him to take us to the guru, right? He took us to the Shabad Guru, he took us to Guru Ramdas, he took us to all the other gurus and Sri Guru Granth Sahib, all right? He's a spiritual teacher. So he's a servant. And I think his proudest title that he gave himself actually was that he was the first servant of the house of Guru Ramdas. So actually he was born to, let me add to that what I was planning on saying early on in the talk is that he came to the United States for two reasons. One was to dump the mailbag of all the techniques that were coming through. And secondly, was to create teachers, okay? He didn't want a following. It didn't mean anything to him. Because if he left and is nothing but jerks, what does he have, So he wanted people that could do as much as they could to carry on without him as if he was here and we could still connect with him. And we can. It's like I can chant to Guru Ramdas, Guru Guru Vahe, Guru Guru Ramdas, Guru, and Guru Ramdas is there for me. All right? But Ramakrishna, the last thing Yogi Bhajan said to me when I saw him in his physical form last, which was about the year 2000, he made it clear to me that I would know that it took 25,000 years to develop Kundalini Yoga. All right? And at different times, I'll explain that a little bit more. But he also said that Lord Krishna was a master of Kundalini Yoga and a teacher, of course, of it as well. And he taught it. So, and Jesus the Christ, they call him Jesus Christ, like Christ is his last name, but Christ means the clear one. Jesus is the clear one. He was a master of it. But Lord Krishna also was a master in a Mahan Tantric. He taught white Tantric yoga. So all of this stuff goes back into civilizations we don't even have in record here anymore, at least in the Western record. So stuff after it was discovered then got copied, so to speak, in the ether, in the etheric realm, in the Akashic records. And there was always one master, one Raj Yogi that was the guardian of all of it. And from at this point, it's Guru Ramdas who is in charge of that huge ancient technology of the mind. So it's not like it was just the last 25,000 years. It could have gone back 800,000 years. But it took 25,000 years total to develop what he started teaching. And he taught about 5,000 different meditation techniques. And I wouldn't be surprised if there's still more in the ethers that hasn't been taught. So does that give you a history and sort of an answer to your question? So that's how Yogi Bhajan fits in. He just saw himself as a mailman and as a spiritual teacher. And he was a tough cookie, but a great, great, great teacher. I never had interest to find a spiritual teacher. I didn't know what one was. But the first time I met him, I thought, God, I hope this man is my spiritual teacher. And it turned out he was.
Mm-hmm.
So, he could see anything and everything. I mean, he could see what you were going to say 9 months in advance, word for word. And he proved that to me a number of times, and to most of his students. He could see the future. He could see all of your past lives within about 2 minutes. So he knew who would betray him, who wouldn't betray him, etc. But he still taught them anyways. He still prayed for them in his sadhana.
There are two parallel movements going on in Christianity. One opposes yoga in general. The other one tries to Christianize yoga. What is your opinion about these two groups?
Well, eliminating yoga is like eliminating a huge ancient technology of the mind, right? Because that's what it is. One of the things I've been trying to communicate to you is look how diverse and different each technique is, It was like 4 parts in, 1 part out, 3 minutes, 8 parts in, blah, 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 blah. I mean, these things are so technically advanced compared to just right or left nostril breathing, etc., etc., etc. And when was the last time you saw something like this for developing the supernatural powers? So, does that answer your question? So, I can't agree with pushing yoga out of the picture. And Jesus the Christ was a great yogi. He studied in India, he studied in Himalayas, he studied in Kashmir, he studied in Persia, he studied in Egypt, And then he came back and he was completely awakened. And in the West, he was the only one that they knew. So they looked at him as God, as the Son of God. And some people think that he is God today. He's certainly God conscious. He remains in the ethers. He's as enlightened as he ever was. He's more powerful now than he was when he was in a physical body. He could do all the cities. He had mastered all of them. He materialized things, He healed people. I hope that answers your question. If not, ask me a little more.
One last thing, when I asked you to explain some meditation technique, when I write to you, I will get an answer. But if you answer here, a larger part segment of the audience will get the answer. How to deal with a stagnant life and how to embrace change.
You're radiating everything that is you. There's a radiance coming out from you. There's 2 ways to get things in life. You go grab after it and pull it in. Or you just radiate and things come to you because you become a servant of the divine. You're working for the divine. And therefore, I wouldn't say they exploit you, but they employ you to serve in whatever lineage it is. So the masters in the divine, circumstances bring things to you. If you have good karma, good things come to you. If you have bad karma, bad things come to you. So get cleaned out so you can attract anything and everything, that you can make the prayer and it all comes true. I'm going to send you later this thing. Go ahead.
Any quick fix technique like a manifestation technique or something?
Is there?
I said like any quick fix technique or a mantra or a small meditation manifestation method?
All of these things help you manifest because they clear out your blocks to begin with. They change your frequency. So your radiance changes. And so you attract some things and you repel other things. In Japji, I'm going to send you send me an email I can send you directly what the different pores of Japji do. And you'll find some of the formulas in that. I do Japji 3 times. First thing I do in the morning, after I chant Om Namo Gurudev Namo. After I took a cold shower, I put my hair up first in a rishi knot to concentrate the energy so I'm not bleeding it out. I'm empowering my crown chakra. That's what all the hair was about. Which religion didn't wear a turban? Hindus did, Jains, Muslims, Christians, Jews, but it got smaller and smaller, and people forgot because they lost their spiritual discipline. So they lost their ability. But the hair is very powerful, and it will help you concentrate and consolidate your energy so you don't lose it. I'm going into a little bit of a different thing, but your radiance or lack of radiance is your limitation or your blessing. So the more radiant you become, the more things will come to you. When you chant, you know, when I've done a great sadhana, I'm going out in the world, people come and they want to talk to me, and they make sure they're standing right in front of me. If I move a little like this, they'll move a little like. They want to get right in my aura. So because subconsciously they're picking up my energy. All right. So that's attracting stuff, and you have to deal with it. But there are techniques for prosperity, all right, for bringing money to you. Yogi Bhajan must have taught at least 20 meditation techniques for prosperity.
The question is not how much I can heal different parts of me or how much I can attract into my life. The question is about knowing who I really am beyond all this.
Well, you become enlightened, you know. Let me put it this way. Kundalini Yoga activates a lot of regions of the brain to alter our consciousness, to give us a different experience, to give us different talents, different perspectives, and you can ultimately become a transcendental being in a human form. That's what Yogi Bhajan was. He could be talking to somebody in his office and having conversations or being aware of conversations on different parts of the planet all at the same time. He was multidimensional. So you can imagine he knew who he was, right? So become enlightened, become disciplined, have the best tools. You know, for 30 years, I've been trying to help people in India. And it's like knocking my head against the wall. I'm telling you that because there's this competition of this spiritual versus that spiritual and my guru and that guru. All I'm trying to do with my life is bring credibility and awareness to Kundalini Yoga as taught by Yogi Bhajan, as taught by the ancient sages from, more than 100,000 years ago. And Guru Ram Das is the storekeeper, He's the guardian of all that knowledge. Let me tell you one thing. I sent a channel, I employed a channel to go to Guru Ram Das to see if he could get me a technique for treating bipolar disorder patients. And you know what the channel came back with, who had no background in yoga? He came back with 3 techniques. One to resolve the condition, one if somebody's in the manic phase, one if somebody's in the depressed phase. I was delighted. I thought, wow, But because of the role I'm playing now and the role I've always been playing, I was granted that blessing. So it's in my books. It's in Sacred Therapies, and it's in the first one too, with the blue cover. The stuff is very, very powerful medicine. So the more chanting you do, the more you get cleaned out, especially if you're doing powerful kriyas, all right? Powerful meditations. Learn to breathe at 1 breath per minute. You have to activate the rest of your brain. Yogi Bhajan used to say on rare occasions, most humans only have 3 to 5% of their brain working. When I heard him say that the first time, he then said in the same lecture, it was in October of 1974. I went to a White Tantric Yoga course. He said 90% of my brain works. And I had no doubt it did, because he seemed to know anything and everything about me and everybody else. And he was so powerful. The energy of that course was just beyond belief. All right. So I was blessed to have the experience of serving him, working with him, being a colleague, serving. Yogi Bhajan, when he was born, he saw auras.
I'm just trying to understand that despite so many scientific benefits which Kundalini Yoga possesses, despite that, why is it so that it is not very widely accepted yet?
Why is that the case?
Yes.
All right. You know why? It brings me to a statement that Yogi Bhajan made. He said, my problem is that I have to compete with everybody else to get the stuff out there, In the West, who wants to go to a man with a turban, with a beard, and all the other people, all of us students? So it was competition, There's even in the spiritual world, there's competition. Yogis, gurus, siddha masters, And so that was one of the difficulties. And it looks religious. And you can say, yes, it is religious. But to me, the teachings of the Sikh gurus weren't really about religion. They were about the techniques, the shabad formulas, the technology, all right? Because that's what it is. With a lot of religions, they practice rituals that don't give them the experience of reality. All of the shabads in Sri Guru Granth Sahib are individual formulas. You don't even have to know what they mean. You just have to know what that formula is for. And if I send Sonam the list of what the different puris and japji do, she'll understand better and she can share it with you, unless you want to also send me the email. I do japji 3 times, then I do Shabad Azari, and then I do some of the puris, for about 5 minutes each, and then I do other meditation techniques, etc., etc. Depends on what I need that day and how disciplined I am, how driven. That's the hardest part, is to be more and more and more and more driven. Because how awakened do you want to become? How divine do you want to be? How much of your brain do you want to work? That's what it comes down to. That's what yoga is really all about. It's a science of the brain and the body. It's not a religion. Kundalini yoga, we call it Kundalini yoga to differentiate it. But up until about 3,000 years ago, there was only one big bucket of yoga, so to speak, one system. And then India was invaded. And the invaders said, there's no way we're going to let you practice this stuff because we won't be able to dominate you. We can't manipulate you. So it all went underground and a lot of it disappeared. But it was always stored in the heavens.
But still, if we consider the mantras which you were reciting, that will make it spiritual or religious to people.
But it looks like that. So that's part of the problem. But it's, if it brings you money, the mantra for money, don't you think they would like that? Or to become absolutely blissed out? Sure. Mantras look like they are religion. You know the word God? You know that word. Who doesn't? Everybody does. But did you know it's a mantra? God, 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 God. The people that know the word God don't know that it was a mantra. So they don't chant it. So they don't become awakened. It's a process of development. The mantras clean out the garbage. They guide your consciousness. They're like a gyroscope on a spaceship. They'll take you to where you need to go. They'll give you the sense of direction. It'll take you into the realm of the infinite where you don't even know where that realm is. It builds the platform, it cleans out the garbage, it helps you restructure your consciousness, and it helps to awaken your superconscious mind. That's what mantras are. They're mind protectors.